A full spectrum of experts and change makers, including company presidents, CEOs, government ministers, and providers, fintech startups, financing experts, and NGOs to discuss an important topic of accelerating and sustaining investments for financing India's healthcare needs. Over 170 delegates from across the country, consisting of doctors, healthcare managers, academicians, researchers, and students, attended the event who wanted to know about the finding and way forward of the financial challenges in healthcare sector.
I have been world over to different locations to check on the best of facilities for medical tourism, and the Goa government is serious. Over the next 6 months, we'll have a framework ready to take and in the true sense work with the pioneers who have actually brought medical tourism to the country, like Dr. Devi Shetty and several other people, in actually having the best setup here so that people from outside can come into the state of the Goa. One is for treatment, second is rehab in another big way. Second, another thing is where during rehab you have assisted rehab and assisted health for people, that is in terms of old age homes and several other projects like that which are in the pipeline as far as government of Goa is concerned. We have already identified a hospital in Medgate where we want to make that a hub for medical tourism and take it forward. And we think that Goa has a tremendous potential, and we are working and we will work with the private sector on making this happen. Also, there are several interests being shown by several governments internationally that want to work with us in creating a tourism hub, medical tourism hub in the state of Goa. So we're very open to these ideas to take things forward, and they're pretty impressed with our outreach programs, what we're actually doing, and so we want to take the help of these people so that those patients there which don't get timely health care, they can be treated in the state of Goa, and this will be of great benefit not only to the government but to the private sector also in the state of Goa.
So in my opinion, the government of India needs to do a costing study in a scientific manner so that we can find out what it costs each hospital, whether it is government or private, the cost of a procedure, so that we can lay those costs down in a meaningful way. And this will also be very helpful to the insurance sector later on. Every responsible country, developed country in the world knows what it costs at what level. The second thing which I was saying in my talk here today was that it should be the costing or the pricing should be differential in nature. Differential means that if you're an A-class hospital with a cardiac surgeon who's been operating for 35 years, has got 10,000 cardiac surgeries under him, he cannot be paid the same amount of money which you pay to a newly qualified cardiac surgeon in, say, a small 50-bedded hospital or 100-bedded hospital. So these are things which I have talked about costing, and I'm glad that the government of India has now formed a committee under the Community Health Department and PGI under Dr. Prinja, and they are arriving at these costs. Hopefully it should be done sooner than later.
I'm very delighted to be part of the second annual healthcare conference of GIM, and it is very gratifying to see that many top healthcare leaders, both from government and private sector, have got together to discuss very relevant topics like how to accelerate and sustain financing investment in healthcare. So it is good. Healthcare always has been plagued by so-called trust deficit. Only through efforts like this, conference like this, getting together and discussing together, healthcare issues will be resolved, and which is going to be very good for the progress of the nation and health of the nation and progress of the healthcare sector also.
Healthcare in India is beset by many problems, and one of them is lack of adequate number of skilled medical and healthcare personnel, and it's relatively long gestation to create a large number of doctors and nurses and so on. So where AI can help is actually in two ways. One is that health personnel at different levels can actually operate at a higher level if they are supported by AI, especially if the AI is backed by language technologies and oral interfaces which make it even easier and quicker to use. So medical personnel at every level, ASHA workers functioning almost like a nurse functioning almost like a doctor, doctor functioning almost like a specialist. And in all of these cases, if they are backed by the right kind of AI, In fact, the accuracy levels could be higher than they are by such personnel today.
As I said, the states are so diverse, there is no one way forward. There are multiple ways forward. And we have done some thinking about what we need to do on the financing side. 3 or 4 things that we could think of. One is that we have about 40% covered by under PMGA, bottom 2 quintile. And we have 10-15% people who are employed formal and they have their private insurance. In between there is a large mass who are uncovered. So we need to do something for them, some instrument, something. And it's not that we are not spending money on healthcare. So we are spending about 5 lakh crores in healthcare, of which 3.5 lakh crores comes out of pocket. Now that is most inefficient way of spending, because individual patient has to negotiate his own rate with the individual provider. Can we do something to pool them? So without having any extra cost, can we just move from what we call as post-paid care to prepaid care? The second is about there are multiple payers, how can we consolidate? Third one is about how do you encourage new and bigger hospitals. As I said, 98% of the hospitals or facilities are less than 10 workers. Now that is not how our health system should be running. So what are the set of policy incentives that can be put in place that would help people to get together minimum size facilities? Because minimum size facilities, you will not be able to invest, you will not be able to find organized people in technology. So we set of policy measures that can accelerate that process. So these are the things that we are suggesting.
I believe that people are calling this environment challenging, but challenging is when it is fun, and there is always a way out. And I think the few things that we need to do is leverage partnerships, leverage technology, which is innovation, and leverage working with government from a policy perspective. I mentioned technology, so using things like artificial intelligence, doing remote sort of diagnosis, all those types of things.
I used to be in the pharmaceutical industry in marketing. I'm very passionate about teaching, and therefore I got into academics. It's now 20 years that I've been working with the GoaInstitute of Management. A fantastic place to work, a fantastic and even better place for students to study.